you know, this is it, this is the light that everyone talks about, but I didn't feel at peace. I felt horrible. She gets mad when I vlog because she doesn't like the way she looks in the videos.
No, I don't.
But the genetic counselor just left, and the geneticist should be in a couple minutes.
Basically, Cheyenne's a big mystery.
They said that they are glad that they found the cardiac mutation. It's something we can keep an eye on, despite how unexpected it was. And that the FLNC mutation, the one that's neuromuscular, it could be related. If the geneticist thinks so, perhaps I'll go to the muscular dystrophy clinic. But that was basically the gist of what they said. After we spent, how long were they in there? About 30 minutes. Going over a bunch of random stuff that supposedly happened between now and then, which is hard to remember because
a year ago.
Everything just runs together, honestly.
A creatine kinase.
The video don't even do it justice.
I think it looks a lot higher than what it is.
What do I want to tell the vlog? That illness sucks and it causes grief, anxiety, lack of sleep. Causes you to lose weight because you won't eat. Silvino's eyes looks like 2 piss holes in a snowbank.
The eyes is really red. They feel like they're dry. They're really dry.
I could use a cup of coffee. I'm just saying.
He's just chilling. And I look like I've been drugged through the streets, as my old doctor used to say from peds. It has been a hellacious night/day.
Morning.
7, 8, 3, 4, 10 hours and 45 minutes because it started about 6 p.m. It's almost been 12 hours.
You think they're gonna?
Around 6 p.m. I started into one of those stomach attacks. It subsided, but I connected back to feeds at 10. And once I did that, it was all she wrote. There was just like pain everywhere from the top of my stomach to near the bladder area. I can't pee. I'm like dry heaving, venting dark green out of my stomach.
Scrambled eggs.
Well, that's not dark green anymore. That's a scrambled eggs. The scrambled eggs is from the duodenum and the greens from the jejunum. Yeah, and surprisingly, my lipase was in the 30s.
Yeah, go pancreas.
But my white blood cell count was elevated. It was 12 something.
12-1.
And my normal is anywhere from like 6
5 to 8.
I shouldn't have cried.
3 hours down. Reason?
I shouldn't have cried.
For Teddy, of all things, why would you like prefer Teddy of all things? Little dog.
Well, he's a baby. And he doesn't like being alone, and he's upset.
Yeah.
And I feel bad because it's my fault. I got my CT results back. They compared it to my last CT, and they thought that my colon looks like it's twisted. This they called surgery, and surgery wanted an additional dye study where they would shoot this contrast up my bum in IR and see if it goes around the bend. And if it was, then I would go in for surgery or to have a rectal tube put in to deflate.
You wanted to see if there was a twist and the splenic fixture.
But as y'all probably recall from my billion tube changes, IR is not my biggest fan. and they refused to do the dye study. Now I'm going directly into surgery to have a colonoscopy done, and from there they will either deflate the colon or fix the volvulus, and there's obviously more of a risk of perforation because my colon's already so dilated. So there's the chance of the ileostomy.
And Zyvox, those are the 3 that she's not went into anaphylaxis.
Styling.
Do you know she's ever had Flagyl? That's what they're saying.
I've got anxiety. It's taken them like, say, about 2 hours just to get all the medication stuff figured out because of all my anesthesia complexities between the mast cell stuff and the heart stuff, and they're gonna use Presidex, that's what it's called, right? Instead of propofol, because every time I get propofol, I progress permanently. Did I even say what they were going to do to my intestines?
I don't know. We don't know what it's
I don't
gonna
even
be
remember.
yet.
Each time the surgeons come in, it just goes from bad to worse. Like first it was just a colonoscopy, and then if they did the colonoscopy and they couldn't get around the bend there, then they would open me up. But now they're opening me up regardless because the surgeon says that they can only see from the outside and they can't go in first. So we'll see. And I may be out of gallbladder too. This vlog is like in snippets because I've been so out of it. But the whole gallbladder part of this is while the surgeon was already in there, he was supposed to be checking out my gallbladder. And if it looked bad from the outside, like if it was necrotic and just diseased, then he was supposed to remove that while I was already under. They went in, and because the damage was worse than they thought with the twist and the colon, they had to remove almost the entire colon. I was left with a couple inches of my sigmoid, which is the very end piece of your colon that is normally like about 16 inches when you have your full thing, and I only have a couple inches of that. And they resected that with my small bowel. Apparently, this whole time, the nurse and my parents kept smelling some sort of smell that smelled like BO, is what the nurse said. They're probably thinking it's me and just don't want to hurt my feelings.
That is hilarious.
Look at this.
And anyways,
Oh my Lord, don't throw it in there, it'll stink up the whole room.
anyway, Silvino was looking at one of my lines and he noticed something was leaking out of my bag that my Benadryl pump was in. But instead, it is
Be very careful with your Benadryl.
Is this stuff right here?
it's some yummy Ehlers that's fermenting.
Legitimately fermenting.
Like it's like black. I don't know if you can see that one there.
Oh,
Oh, that's disgusting.
I can't wait to tell Robbie I thought it was you.
Well, my catheter is causing issues. And, you know, he's been all up down there, so I mean, if it were me, he would have smelled it then.
I mean, you don't have any problems with all these guys playing with your hoo-ha.
Oh my goodness, Mama, I'm on the vlog.
I gotta find your trash. Is there one underneath there?
Well, when you've been sick for as long as I have, at this point, you just lose all care and dignity. We just cut my fentanyl pump in half because I am so itchy and I'm high. So I woke up from surgery and it was the best I have ever felt waking up from surgery, mast cell wise. They used a different anesthesia concoction than what I normally do. My first ever surgery was to remove an infected lymph node that developed into a little tumor on my scalp, and I had to have that removed. And that was the first surgery I'd ever had where they used propofol. And once I awoke from that surgery, that is when my bladder symptoms came on, and ever since that day I have had the burning, the urgency, and all of those type of symptoms, like difficulty releasing, that all of those that come along with the bladder problems that I've been experiencing. After that, my muscle involvement also got worse. My next surgery after that was my Nissen fundoplication. and they used propofol afterwards, and I woke up and I wasn't right. I knew something wasn't right. That's when I started having increased fainting episodes. I was already having problems with that prior to the surgery. My gut shut down even more. A chronic pain came on. Just everything that could worsen did. And so we eventually started noticing like all of these correlations with procedures, like as every procedure or surgery that I had had made me permanently worse. So in 2013, when I had my first GJ tube placed, they decided not to use propofol. They used something called rocronium and a couple other things. And when I did that, let's keep in mind that I've never had a mast cell reaction at this point. I woke up great. I did not permanently progress. Like, it was really good. And then I had a doctor, convince me to use propofol again for another procedure, and that didn't go well. During that surgery, they had also given me nitrous oxide, and with the nitrous oxide, they were trying to get in an IV. I was in a different state doing some like particular testing, and it was horrible with the nitrous oxide at first, because as soon as they put the mask on my face, every word I heard while they were doing that started repeating over and over. And similarly, every vision, like everything in my field of vision that I saw right as they were putting on the laughing gas mask, started swirling around and around and around into a circle until everything was like a swirling black hole. And then everything just all of a sudden went white. And once it went white, I started hallucinating. I was hallucinating that my mom was behind my head and Silvino on the side right to my arm. And then I kept trying to move to tell them, because I couldn't even feel my body. It was just the strangest sensation ever. And I couldn't move. Like, my brain could think, but I couldn't move to tell them that I was having a problem with it. And at first, when I saw the bright light, I'm like, okay, this is it, I'm dying. You know, this is it, this is the light that everyone talks about. But I didn't feel at peace. I felt horrible. They finally got the IV in, and they had given me the propofol, and I woke up, and I was terrible. That was when I was swollen from the gas. My temperature dropped to 94 degrees Fahrenheit, and normal is 98.6. So I woke up and all these blankets were on me. My pulse was over 150. I was just hysterical because I kept trying to tell them all about my hallucination and everything that had happened previously. But they weren't understanding, of course, and I was tremoring, and then that eventually did subside, the weird reaction part, and then I had everything else that the propofol normally causes, so like increased weakness, and my gut shut down some more, and I just never recover once I'm given propofol. So with that being said, like, that's why I liked the rocronium, because I knew that while yes, even if I do have a problem with it, it doesn't cause me to permanently progress. And that was the case, because when I needed a second surgery when I was down in Florida, they used rocronium again. And I didn't have it cause the same stuff that the propofol normally does, but this time, because now my mast cells were set off, and my mast cells were already in a fit. It didn't tolerate the rocronium, which is something that causes mast cell degranulation in normal people. So afterwards, I was just a wreck. My spleen swelled up because my mast cells were so angry. All my counts started dropping. I just was going into reaction after reaction, and I couldn't even breathe because my spleen was so swollen that it was pushing on my lung, and then they had displaced my NJ tube I had in at the time. They removed my catheter, but my urine retention has been a problem, but I'm begging them not to. My small bowel is becoming dilated too. Yesterday they had to go in and take an x-ray of that, and this morning I went into another terrible pain episode, exactly like the one that brought me in here, except this time I couldn't even move around because I have the surgical complications on top of it. And they took another x-ray that is not looking good either. They're about to drop an NG tube because although I have my GJ that I've been venting from through gravity, they can't hook that up to the pump, and we need some more intense venting to try to get the dilation of my small bowel down.
You know, I just thought of something. That is the EHP free, right?
Like, those do look different than any of the ones I've ever used before.
Yeah, those aren't the ones we've ever had.
Well, I've waited 5 hours to get my NJ tube, and right at the last second, my mom asked if it was PVC and DEHP free, because with my mast cell sensitivities, I don't tolerate any of those plastics, especially going down my esophagus. And they didn't think to look at that, so that was almost put in me. And now they are claiming that they're not gonna do the NG anymore because they say they can't use anything else, when I know they have another NG catheter that is free of those things, because I know the pediatric patient they used it on. I was holding out hope for those things, and I can't seem to stay awake more than 5 seconds. Because of this fentanyl, I keep reacting intermittently, but it's the best I have.